Welcome back. In this part of the respiratory system, we're going to be learning about the larynx and the associated structures. So we're doing everything from the upper neck head junction down to the neck upper chest structures. And so the larynx is a group of cartilages with some muscles, and the upper border of it is where the hyoid bone is located. So on all the models, they'll always have hyoid bone easily seen at the superior aspect of this. And to remind you, the hyoid bone was C-shaped with the curved part anteriorly and having an open back. The hyoid bone is tucked up here inside your mandible. The first cartilage we're going to learn about is called the thyroid cartilage, which is kind of a misnomer because the thyroid gland is not sitting on top of the thyroid cartilage. The thyroid cartilage is what's known as the Adam's apple in men. And all of you can feel it in your neck. It's that big piece of cartilage. Now, you can't do it when you're talking because when you're talking, it goes up and down. And if you look at the thyroid cartilage anteriorly, it's quite a large cartilage, and then it goes around to the side. And I like to tell students it's kind of like the perfect little black dress. Anteriorly, it's got this lovely little sweetheart neckline here. So it has these little arches, and then it has lots of side boob coverage. But then posteriorly, there is no back. So it's a backless, sexy little black dress. Okay. So if you were looking at the larynx posteriorly, none of the cartilages posteriorly are going to be thyroid cartilage. Anteriorly, it's quite large. And on the side, it's very easy to see as well. Continuing inferiorly, just below the thyroid cartilage, is the cricoid cartilage. So if we look at this picture where blue is the cartilage, because on most of your models, blue is going to be cartilage, it's just that big one on the right. For some reason, it's gray instead of blue. You can see the large heart-shaped thyroid cartilage, and just below it, a small piece anteriorly of the cricoid cartilage. But if we look at the upper left picture, you will notice anteriorly it's quite small, but posteriorly it is huge. So all that empty space where there was no thyroid cartilage posteriorly, the vast majority of that is going to be filled in with cricoid cartilage. Okay. Now, just superior to the cricoid cartilage posteriorly, there are 3 little cartilages on each side, and we are going to learn one of them because one of them is important for speech production. But before we go there, let's go back anteriorly. So on you, find your thyroid cartilage, feel the little divot, and then you can feel the cricoid cartilage below it. That little divot is where the cricothyroid ligament is located. Notice it's not called the thyrocricoid, it's the cricothyroid ligament. And if you look at this, what you'll notice is like there's very little blood vessels there. All the blood vessels are to the side of it. There's no muscles that are sitting anterior to it. So if you've ever seen the TV shows or a movie like where somebody is choking and the Heimlich maneuver is not doing anything, and somebody takes a steak knife off the table and jams it in there, and then takes part of a pen and sticks it inside, and the person can breathe and is safe. Yeah, it works in real life. This is done more than 1,000 times a day in emergency rooms across the United States. Okay, granted, we don't use pens in emergency rooms. We just have a big fat needle with a plastic catheter we do there. Okay, this is not a tracheostomy because it has nothing to do with the trachea. Tracheostomy is an operation. This is not. All right. So let's look at the back side, the posterior view. So let me orient you again on the picture on the far left. This is the thyroid cartilage. That's the posterior aspect of the thyroid cartilage, the entire posterior view. That is cricoid cartilage. The cartilages which are just superior to the cricoid cartilage, that's the only one we're going to learn. We're not going to learn the little ones making the little tips up here. This right there is called the arytenoid cartilage. So practice saying that, arytenoid, okay? Because this is where your vocal folds will attach posteriorly. All right, now, perhaps you have noticed this thing that looks like a big wooden spoon attached anteriorly and sticking up above the level of the hyoid bone. This is the epiglottis. Okay. The epiglottis is one of the 3 pieces of cartilage that are elastic cartilage in your body. If you recall, your right ear was one, your left ear was one, which left one more, and that's this, the epiglottis. So here's what happens. Here's the opening to the larynx, and the epiglottis is there, and every time you swallow, swallow again, swallow again. So it's going to do this thousands of times a day, and that's why it needs to be elastic cartilage. And what that does is it covers the opening to the windpipe, thereby making food and saliva and other things that you are swallowing go down the esophagus, the food tube, instead of the airway tube. All right, this is a cross section going through the larynx. So you need to orient yourself. I will show you here. This is the anterior aspect. You can tell that because right up here is your hyoid bone. That's correctly. So what do you think this angled cartilage is here? And what do you think this big anterior cartilage is? And then here, there's the cartilage just inferior to it. You got the little divot between the two. And then you have this big piece of cartilage back there. And you can't see it because it's covered by this muscle, but there would be a little piece of cartilage up there. All right. So definitely make sure that you can label all those pieces on that mid-sagittal view. But let's look at the soft tissue in the middle of this. What you'll notice as you're coming down in the larynx, you have this infolding, and then you have like this valley, and then below that, you're going to have another infolding below. So this uppermost infolding, that's kind of like the entrance way going down into the larynx further below. So that is called the vestibular fold. Some folks call it the false vocal fold cord, but we're not going with that term. That is the vestibular fold. And then just, whoa, don't know how that happened. Just inferior to the vestibular fold is the vocal fold. So definitely, when you have a chance, come back and freeze on this mid-sagittal view or take a screen cap of it and label all the cartilage, label the bone, label the folds. Make sure you're well oriented on the mid-sagittal view. All right, continuing on. Inferior to the cricoid cartilage, we're going to be having our trachea. And if you look anterior to the trachea, we have this butterfly-shaped gland, which is your thyroid gland. Now, if you do look at the sides of the thyroid gland, what you will notice is there is a little bit of the thyroid gland, which does cover part of the side of the thyroid cartilage. But do not be confused. The thyroid gland surrounds the trachea. It does not surround the thyroid cartilage. And so then we are in the trachea, and the trachea is just a series of C-shaped rings. You can tell they're C-shaped. If you look at this posterior view, it's all soft tissue. So they're C-shaped with the C facing anterior, just like the hyoid bone did. And they carry down until it's going to be dividing to go into the 2 main airways to the lungs. So with that, we are done with all the structures related to the larynx, and I will see you again soon as we continue this exploration into the respiratory system. Thank you.